Well, it's that time of year again. People are making their New Year's resolutions. Losing weight, eating healthier, and exercising are popular choices. Well, the weight loss craze took on a whole new twist in 2023. A record number of people, including celebrities, turned to FDA-approved drugs for treating diabetes to lose those extra pounds. Prescriptions for Wegovy rose six-fold, while those for Ozempic, the lower dose version of treating type 2 diabetes, increased by 65%. Joining me now to break it all down, the hope and the hype, is Dr. Fatima Cody Stanford. She's an expert in obesity medicine at Massachusetts General Hospital and an associate professor at Harvard Medical School. Dr. Stanford, I can't think of a better person to talk to you about this than you. So many questions for you. First of all, how safe are these drugs?
Well, they're absolutely safe. I can tell you about this class of medications. They have been on the market since 2005. So we have a lot of safety data for these medications. These are medications that we call GLP-1 receptor agonists, or glucagon-like peptide 1 receptor agonists. And we have close to 20 years of data. What we do know about these medications is that we know that they are helpful in reducing cardiovascular events. We know that they're helpful in reducing strokes, heart attacks, admissions for heart failure, and a host of other events. So with regards to the safety profile, these are some of the safest drugs that we actually have available on the market today.
So how do they actually work? Do they suppress one's appetite?
So actually they do, but let's talk about how they're a little bit more complicated than that. They actually work on pathways of the brain that regulate our appetite. So they actually work on the primary pathway of the brain that tells us to eat less. That's a pathway of the brain that we call our anorexigenic pathway of the brain, and they down-regulate the pathway of our brain that tells us to eat more. So they're a little bit more complicated than just an appetite suppressant. A lot of people think they're really as simple as that, but they do a lot more than that. They actually also work on our adipose tissue, our fat tissue in our body, and they actually work in our pancreas too. So they do a lot of things in our body. They're really kind of a complicated type of drug in our body, and they do quite a bit. And so that's why it's a little bit more simple than just like suppressing our appetite. They do a lot within our system, within our brain, within our pancreas, and within our adipose or fat tissue.
So as you know, so many celebrities have been on these weight-reducing drugs, if you will, including Oprah Winfrey. And everyone I know who's battling weight issues is considering, because they're like, look, this person is doing it, Oprah is doing it, that person is doing it, all these celebrities are doing. So how do physicians determine if this is the right drug for you? And are you concerned at all in 5, 10, 20 years from now, we're going to learn about some terrifying long-term effects?
Well, absolutely not, actually. So I think with someone like myself, who's a scientist, actually studies these drugs. I told you, these medications have been around for about 20 years. So we've been studying these drugs as a scientist for about 20 plus years. I'm not really scared about the long-term side effects. What I am scared about is those people that are using these off-label, not working with persons like myself that are actually using these drugs in the way that they're actually supposed to be used. People that are using these from medical spas, things that are not in the ways that they're supposed to be prescribed, skipping doses. These are things that are really unsafe practices with regards to these medications. And I am terrified about people using these in unregulated fashions. These medications can be used in a very safe fashion, but they should be used by people that know how to prescribe the drugs in a safe manner. And I see a lot of people not, focusing on these ways of using them. And this is where we're getting into a lot of trouble. And so that's where I am concerned with regards to the use of these medications.
Dr. Stanford, what about causing a shortage for people who really need these medicines to treat diabetes?
Well, so this is a dichotomy that I'm also concerned about. These medications are approved by the FDA for two uses. Number one, to treat diabetes. Number two, to treat patients with overweight and obesity. This dichotomy, or as polarizing one disease process versus another, is a false dichotomy. These are two very serious disease processes. The number one disease process in the world right now is obesity. It's the most prevalent chronic disease in human history. Let's not recognize that the fact that obesity is the #1 disease process and that 80% of those that have type 2 diabetes also happen to have obesity. So this dichotomy of one taking it from the other is really a false dichotomy. Now, we need to make sure that we aren't taking one from the other, but the reality is that most people that have diabetes also have obesity. So I think we have to recognize that dichotomy also.
We're going to leave it there. An important and very timely discussion. Our thanks to Dr. Fatima Cody Stanford.